we wanted to talk a little bit about the impact of EHR, health information technology, but specifically EHRs on small practice. My name is Dr. Jimenez. I'm the CEO of ImplementHIT. We like to try to divide this up into kind of challenges and benefits. I think everyone understands that the benefits of implementing EHR lead to, most importantly, patient safety benefits, improving the quality of care. And that can come in many different ways in terms of reducing the amount of unneeded diagnostic studies and those sorts of things, using decision support to ensure that you're providing the most up-to-date practice guidelines with your patients. It's also clear that the implementation of an EHR, especially the right EHR for your practice, can add to productivity efficiencies that will lead to return on investment. But there certainly are a number of challenges as well. And as a small practice, and me being a practitioner in a small practice under 5 physicians as well, not only helping groups with their EHR implementations, there are significant challenges that smaller groups must be aware of. One of the most important ones is the impact of the EHR implementation on your productivity levels. Unlike many of the larger enterprise organizations that we implement, a lot of different across the country, they have so many physicians that taking a single site live and them having a 25% productivity hit for 3 months is something that they can manage, right? Because they have their economies of scales and they can absorb that cost. Whereas a 5 provider or under group having to take a 25% hit on productivity will be extremely difficult to them. So there are many different steps that small organizations, and strategies that they can employ in order to minimize that productivity loss. Here at ImplementHIT, we focus a lot on the training aspect and how can we emphasize training during our implementation so we can not only get advanced levels of use, but also so that we can get to those levels without an extreme hit on your productivity. One of the ways that we can do that with training is by having an approach where we can reduce the amount of time physicians have to spend outside of their clinic and in a training room in order to become proficient with their EHR. We do that by implementing an online training component to this. We use our advanced training platform called OptimizeHIT, OptimizeHIT.com. And what that allows folks to do is, it's not the traditional type of learner management system, but really is geared for EHRs. So the way OptimizeHIT works, and I think the way our learning strategy is unique, is that the implementation is not our endpoint. The clinical adoption, advanced clinical adoption, is the endpoint of training. Instead of trying to cram in everything a physician will need to do to become an advanced user prior to even using the EHR for the first time, we create a different type of curriculum where we give the fundamentals initially prior to implementation. And then that first week of going live, if you're a primary care practice, you may see 150 plus patients in that week alone. And that is a wealth of experience from which we can build upon and provide additional training in a much more efficient process. And we use our platform to provide the pre-implementation training, but also to provide that vehicle for continuing training at the pace and when most convenient for the physician who needs to participate in that. By doing that, by reducing the amount of on-site time prior to implementation, by moving some of that, those training objectives to an online platform that you can complete at your leisure, we save some time out of clinic there, right? Save some impact on your productivity. But I think even more importantly is the ability to move beyond being a basic user and have a way to move from basic, intermediate, and advanced at your own pace as you capture additional experience, and then get to the levels of productivity that you were, maybe even surpass that prior to implementation, while capturing all the other benefits of the EHR. So we think that, especially for smaller practices that are more sensitive to the impact on productivity, having a very effective training strategy that's efficient, that can keep physicians in the clinic longer while giving them a means to get to advanced levels of clinical adoption is the key.